I am Kiran Saluja. I'm here from Los Angeles. I work with this very large organization that Dr. Chu told us about. And I'm also here as the voice of the National WIC Association, which essentially is the advocacy voice of over 12,000 service agencies that provide WIC services to over 9.2 million participants throughout the country. Of these 9.2 million, 7 million are infants and children under the age of 5. And exactly what we're talking about here today, preventing childhood obesity, really needs to start in the WIC program. And I'm here to tell you that we have a solution. We can actually start to prevent childhood obesity from the day the child is born. And the way we do it is by ensuring that this child gets exclusively breastfed. Not only does he get exclusively breastfed at birth, but he gets some duration. Because according to the Centers for Disease Control and Prevention, we can prevent 15 to 30% of childhood obesity if the child is breastfed. And the greatest protection happens when the child gets no formula, no solids, and it goes on to at least 6 months. Now, this is a magic pill. Why haven't we embraced it? Well, it certainly isn't for lack of effort, because I want to thank all the members of this committee. I want to thank Chairman Miller specifically, Representative Carolyn McCarthy, the chair of the Healthy Family Subcommittee. Thanks to all of you. The Ag Appropriations Committee bill provided a major expansion. They quadrupled the breastfeeding per counseling monies in the last bill. They created a new breastfeeding performance bonus, which is very unusual and was extremely welcomed by WIC agencies, and provided new funding for evaluation of program effectiveness. The WIC food package was like manna from heaven for all the WIC providers. We'd been waiting for it to change, and October of 2009, it did change. And it's a fabulous tool for us to really get out there with good nutrition messages, and it has a little extra food for the fully breastfeeding mother, which helps us package exclusive breastfeeding. Now, you might say, well, what is WIC doing with breastfeeding? Well, our rates are increasing, but they're increasing very slowly. And we're lagging behind the national data, because non-WIC moms do better than WIC moms. And so why is that happening? Well, I'm here to ask you for 5 things. Everybody's asking you, so I'm sorry. I'm going to 5 asks. Number 1, we'd really like you to direct Food and Nutrition Services to restore the $2 increment that the fully breastfeeding moms had when they had that little extra edge. It doesn't sound like a lot, but that $2, you know, that WIC staff out in the field can really leverage it when you're working with a mom, when she's kind of vacillating. I don't know, what should I do? Well, you know, you get extra fruits and vegetables, so we'd really like to see that put back in. We'd like you to make us some time so we can help mothers where they need the support. And you might say, well, how am I going to do that? I can't create time. Well, yes, you can. You can help us by extending certification for children, that is 40% of our participants, to 1 year. We do that for breastfeeding moms. We do that for infants. We should do it for children. That will release precious minutes that breastfeeding mothers need for support. Now, what about barriers external to WIC? Because everybody doesn't live in the WIC world. If they did, trust me, we wouldn't have childhood obesity, and we would have everybody breastfeeding, because that's how committed your WIC staff is out there. Well, the external barriers to breastfeeding really mean comprehensive policy changes in the institutions that our mothers go to outside of WIC, because we really need to optimize this money that has been put into WIC to do what we should be doing. And I'm really speaking specifically of unsupportive infant feeding policies in healthcare systems. I'm speaking of the intense direct marketing of infant formula, and I'm speaking of poor community and workplace support. So what I'm asking you all is to really, I hate the cliche, think outside the box, but think outside the box and work with members of Congress and figure out how can we tackle this problem? How can we pass legislation that says if there are Medicaid births happening in a hospital, that hospital should not sabotage breastfeeding. It should support breastfeeding. And you might say, how does it sabotage breastfeeding? Babies get given formula bottles right at birth. Mothers get separated from their babies. It's not that people want to be mean, it's just the policy. It's like an archaic policy that needs to be changed. And there are hospitals now that have embraced policies. Outcomes are different. Oregon has some very wonderful hospitals. Northern California does. Throughout the country, we have some very good models. I'd love us to have many more of them throughout the country. What about marketing of infant formula? You might say, well, you know, my time is almost up. Moms get very confused with marketing messages. They come to WIC and they say, can I have that breast milk in a can? And we're like, there's no such thing. And it's because they get free formula when they leave the hospital. They get formula coupons and free formula at their doorstep. This has to stop. We are spinning our wheels in the WIC program. Our mothers are suffering, and our babies are getting fatter, and none of us really want that. I know my time is up, so I will not keep that beautiful quote that I had at the end. I had 2 more asks, but they're in my written testimony. Thank you for indulging me. I really appreciate your attention.